surgery. So I've done what is a complete En Bloc, initials AG9424. And these are a set of implants from 1992. Silicone, this is when the silicone implants had just been banned. So as you can see, she had what are implants that old. So this is 32-year-old set of implants. And as you can see, just the fact that they're 32, almost 99% chance that they're ruptured. And this is where they were sitting, what is above the muscle. So as you can see, there's inflamed tissue, abnormal tissue, irregular tissue. And just the fact that they're 32 years old, very likely they're ruptured. So it's not only the implant, but the capsule, but the tissue around that's inflamed, irregular, abnormal, because there might be an extra capsular rupture, abnormality, silicone leaching into the periphery. So what I'm going to do is I'm going to go ahead and cut this open. This was done En Bloc, so none of the internal contents leaked to the outside. I cut out the excess skin, as you will see, full thickness. This helps with the contouring. This lady is a nice lady in her late 60s. And so as I go in, you will see here I've entered, and as I go in, you will see this is the calcification that is present, and indeed, as anticipated, it is ruptured. And you can see how thin the capsule is. If I go, you can see my scissor underneath, basically all contained, none of this spilled into the chest. Blood loss was like, I would say 3 cc's on each side, so a total of 6. And everything contained. So I'm going to go ahead and work this open, so that now I see like a black mark right here on the inside. Just curious to see what that means. As I spill this open, you can see this is your 280cc CUI-DRIE. This is the older generation implant. And you can see indeed it is very much ruptured. And if I put my finger here, you can see my blue glove. And so if I take this ruler, and you can see actually right through number 10, 9, 8, 7. So you can see right through it. I've heard this many times, where the capsule is so thin, they could not remove it. That's the incomplete, wrong answer. The capsule has to be removed. That's because that's the whole surgery. Now there's some parts of it that are crystallized and hard, as you can see right here, like the scales of a fish that you've seen many times, right here. And as you will see, there's inflammation on the periphery. So it's not only this capsule, but the tissue around that has to be removed, because that's where the gel bleed has basically spread to. And again, you will see right here, look at the scales of a fish right here. And you can imagine how hard this was on the chest and in the proximity of the nerves. If I go like this, you will see how hard this tissue is, and you can snap it. So again, not healthy. And this is where these, if in the proximity of the nerve, can cause pain. So this is a ruptured implant. As you can see, none of it spilled into the chest, and they're not meant to be in the body forever. These are, relatively speaking, and again, not safe devices, especially when long term. They do tend to gel bleed. Now I'll change my gloves. We're going to go onto the left side. And again, let me go ahead and show you. Again, you can see the irregularity over here. We can go ahead and redo it. So we're going to, all right, so I cut out the excess skin, full thickness, a little bit less on this side to make it symmetric to the right. And as I lift up, you will see very thin capsule, relatively thick. All of this tissue is abnormal, inflamed, and so I've had to remove it. All done in the En Bloc fashion. This is the gold standard. None of the silicone spilled into the chest. And actually, if you look carefully here, you can see how thin this is. if you look at the many studies that are done, no one wants to do a study at 15 years later because the chances of rupture goes up significantly, and they're not meant to be in the body forever. And the general misconception is they last in the body forever is wrong. And you can see how this is all contained. You can see how it folds up on itself. And over here, I just want to see if there is any marking or number. So this is your 280 as well. 280cc. Again, you'll see, look at this gray pink appearance. What are the scales of a fish calcifications? And again, relatively some areas thin, all contained, none of this spill into the chest. And overall, I'm happy with how the whole surgery went. Minimal blood loss, no need for drains. Even on the 68-year-old, I was very happy how her skin recoiled minus the implant, and we'll see how she does post-op. There is so much inflammation on the chest as a result of these implants. This is not the time to be doing a lift, especially in someone 68. And we'll see aesthetically, she'll be very happy with how no need for drains. This is the count procedure. No need for drains, no need for the unnecessary lift, even someone 68, especially when she has bilateral rupture implants, and we'll see how she does aesthetically. Number 3, twilight sedation. Number 4, she will get pictures of the chest and also videos of the chest while showing complete removal. Plus, when you combine that video with this one, you can put the two together, and the patient will have the peace of mind and the confidence that all of it was removed. Number 5, the capsules will be sent to pathology, rule out the BIALCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology. Cultures will be done for aerobic, anaerobic, and fungal cultures. And then we will see how the patient does post-operatively minus the silicone toxicity, silicone rupture that she had, very likely for many, many years that she has had. This is Dr. Khan, Executive Plastic Surgery.